thanks. So NSF has a great tagline. It is where discoveries begin. Okay, and so our mission is foundational research and education that's going to impact society 5, 10, 15, even 20 years down the road. That's our mission. So we didn't wake up yesterday and say, oh, wow, big data. We should invest in big data.
Right.
We've been investing in data science and data analytics for several decades.
Right. Your job's to try to stay ahead of that curve.
Exactly. We have to stay, on the wave because our mission is to be on the frontiers of knowledge. But recognizing the increasing emphasis on big data, we decided that we wanted to make bigger investments in that kind of slice of data science.
Okay.
So we joined with the National Institutes of Health, and we developed a call for proposals, asking for teams to submit their best ideas, the most forward-looking ideas. Teams made up of researchers that typically go to NIH, medical researchers, working with computer scientists and mathematicians and statisticians.
Okay.
So this solicitation really formed the cornerstone of the White House National Big Data R&D Initiative. This was launched in 2012. And so we've already invested almost $30 million in new kinds of science. And so one example, breast cancer. So pulling together computer scientists working with medical researchers and cancer researchers, you can really make a difference with big data. So we know that breast cancer is the second most common kind of cancer for women. So by looking at hundreds, thousands of breast cancer biopsy images, you can go and look at subsamples from the images and get down to the most minute level of granularity in terms of attributes that cause cancer. And so we were able to, out of 6,000 different variables, pick the smallest set that was predictive of breast cancer. But then also there was an unexpected finding that the people who were most likely to survive, it was not predictions from the cancer tissue itself, but it was the adjoining tissue.
Oh.
And so no cancer researchers before that had ever even looked at that level of detail, the bench scientists, right? So we know that bringing in computer scientists with machine learning techniques with the cancer researchers, we're going to be able to make a really big difference.
That is cool.